Welcome to our exploration of implementation science in public health. Implementation science is the study of methods to integrate evidence-based interventions into real-world settings. Implementation science addresses the gap between research findings and their practical application. Many effective interventions never reach the people who need them most. Implementation science guides the evidence-based practice cycle, providing methods to effectively translate research findings into clinical practice. The ultimate goal of implementation science is to improve health outcomes for everyone by ensuring faster implementation, broader reach, and sustainable change in healthcare practices. Implementation science transforms how we deliver healthcare, ensuring research benefits reach all communities, particularly those most vulnerable or underserved. Let's explore the evidence to practice gap. Imagine a research paper filled with groundbreaking discoveries. Now picture a busy clinic where healthcare is delivered. The evidence to practice gap is the space between these two worlds. It represents the challenge of getting those research findings into everyday practice where they can help people. Many barriers exist on both sides of this gap. In the research world, barriers include complex study designs, statistical jargon, limited practical guidance, and paywalled publications. In the practice world, professionals face time constraints, resource limitations, organizational policies, and resistance to change. One framework for understanding this gap examines how knowledge influences attitudes, which then influence behavior. Even when healthcare providers have access to evidence, multiple factors affect whether that knowledge changes practice. Implementation science emerged specifically to address this gap. It provides systematic approaches to improve the integration of evidence-based interventions into real-world settings. Frameworks like EPIS, exploration, preparation, implementation, and sustainment provide roadmaps for navigating this gap. These frameworks help researchers and practitioners work together to move evidence into practice through structured, systematic approaches. The goal of implementation science is to build bridges across this gap. By understanding the barriers and using structured frameworks, we can more effectively translate valuable research findings into life-improving clinical practice. Many medical and public health innovations are developed, but never effectively implemented in practice. This creates a significant gap between what we know works and what is actually being used in healthcare settings. Implementation science bridges the gap between research discoveries and their practical application. It's the essential link that ensures effective interventions don't just remain in research papers, but make it into real-world settings. The knowledge translation process is central to implementation science. It focuses on distilling key research findings and translating them into actionable practices that can be implemented by healthcare providers. Implementation science supports evidence-based practice through a systematic process. This cycle includes asking clinical questions, acquiring evidence, critically appraising it, applying it in practice, and analyzing the results to make adjustments. The real-world impact of implementation science is significant. It reduces unnecessary suffering by ensuring effective treatments reach patients, improves health outcomes across communities, maximizes limited healthcare resources, and helps address health inequities by improving access to care. Ultimately, implementation science matters because it ensures that cutting-edge technologies and innovations are effectively delivered in clinics, homes, and communities, bridging the critical gap between discovery and impact. Evidence-based interventions, or EBIs, form the foundation of implementation science. These are programs, practices, policies, or guidelines that have been rigorously tested and proven effective through systematic scientific evaluation. What makes an intervention evidence-based? Several key criteria must be met. An intervention needs a strong theoretical foundation, rigorous research methodology, and consistent positive outcomes across multiple studies. It should be replicated across different populations and settings, with findings published in peer-reviewed journals. Evidence-based interventions draw on various types of research methodologies. Randomized controlled trials often provide the strongest evidence, but observational studies, meta analyses, and other approaches also contribute to building a comprehensive evidence base for interventions. Even with strong evidence, implementing EBIs in real world settings faces many challenges. Various barriers and facilitators affect how well evidence based interventions can be integrated into practice. Implementation science specifically focuses on how to overcome these barriers and leverage facilitators to successfully put evidence based interventions into action. To summarize, evidence based interventions are the foundation upon which implementation science is built. They require scientific rigor and replication to establish their effectiveness. Multiple research methods contribute to building the evidence base. Ultimately, implementation science focuses on the process of putting these proven interventions into real-world practice.
Implementation strategies are the specific methods and techniques used to put evidence-based interventions into practice. These strategies can be grouped into categories such as education, planning, and restructuring. Each serves a different purpose in the implementation process. One well-known framework for implementing evidence-based practices is the model developed by Larrabee and Rossworm. It outlines a 6-step process that guides practitioners through assessment, planning, implementation, and evaluation. When selecting implementation strategies, several key factors must be considered. The implementation context, including setting and available resources, potential barriers and facilitators, and the expertise and support available to the implementation team. A key aspect of implementation strategy selection is considering long-term sustainability. Effective strategies must address economic, environmental, social, and systems factors that affect the continued use of evidence-based interventions. Implementation strategies often involve change management techniques. Traditional change management focuses on controlling change, while accelerated change readiness approaches emphasize preparing organizations and individuals to adapt quickly and effectively. To effectively implement evidence-based interventions, strategies should be matched to specific barriers, address multiple levels of influence, combine complementary approaches, and be adjusted based on ongoing evaluation.
Implementation outcomes are key indicators of how well an intervention is being implemented. These outcomes serve as necessary preconditions for achieving desired changes in clinical or service outcomes. Proctor and colleagues identified 8 key implementation outcomes that provide a framework for measuring implementation success. These outcomes include acceptability, which is how satisfactory an intervention is perceived; adoption, the intention to use the intervention; appropriateness, how relevant the intervention is for a setting; and cost, the financial impact of implementation. The remaining outcomes are feasibility, the extent to which an intervention can be used; fidelity, how closely the implementation follows the design; penetration, the integration within service settings; and sustainability, how well the intervention is maintained over time. Implementation outcomes can be organized into measurable metrics that drive success in implementing evidence-based interventions. Much like business planning metrics that focus on various aspects converging toward a central goal, implementation outcomes can be used to track progress and success of public health interventions. To summarize what we've learned about implementation outcomes are distinct from service and client outcomes. They serve as indicators of implementation success and are necessary preconditions for desired changes in health outcomes. Finally, they can be measured across multiple domains to provide a comprehensive view of implementation effectiveness. Acceptability is a critical implementation outcome that measures how well an intervention is received. It focuses on the perceptions of both those delivering the intervention and those receiving it. The acceptability of an intervention involves 2 key stakeholder groups. First, the intervention providers, such as healthcare workers, program staff, and community workers who deliver the intervention. Second, the intervention recipients, including patients, community members, and target populations who receive the intervention. Let's explore the factors that influence acceptability. This theoretical framework shows various components that influence an intervention's acceptability. These include burden on participants, their emotional response, ethical considerations, understanding of the intervention, opportunity costs, and perceived effectiveness. How do we measure acceptability in practice? Acceptability can be measured through various methods, including surveys, focus groups, interviews, direct observation, and analysis of usage data. In healthcare settings, patient satisfaction is often used as a key indicator of acceptability. These 8 essential elements highlight factors that contribute to patient satisfaction. The importance of acceptability cannot be overstated. When interventions are not acceptable to stakeholders, they are unlikely to be adopted, implemented correctly, or sustained over time. Remember, acceptability is symbolized by a thumbs-up icon, representing the positive reception of an intervention by all stakeholders involved. When implementing evidence-based interventions, a critical question is it actually being used? Adoption refers to the initial decision or action to employ an evidence-based intervention. It's about whether stakeholders are actually implementing the intended program or practice. Adoption follows a process. First, stakeholders become aware of an intervention. Then, they decide whether to try it, begin implementing it, and finally fully adopt it into their practice. The adoption process resembles product adoption in other fields, with phases of awareness, interest, evaluation, trial, and finally adoption. Measuring adoption is crucial for understanding implementation progress. Common metrics include the percentage of sites using the intervention, rates of uptake over time, and differences between intended and actual adoption. Tracking tools like implementation checklists help monitor adoption across different settings and over time. Multiple factors influence whether an intervention is adopted. These include its perceived advantage over current practice, compatibility with existing systems, complexity, available resources, and leadership engagement. Strategic planning that addresses all these factors can significantly improve adoption rates of public health interventions. Let's look at a real-world example. In HIV PrEP implementation, initial clinic adoption rates were around 35%. After targeted implementation strategies including provider training, simplified protocols, and leadership endorsement, adoption increased to 78%. Adoption is interconnected with other implementation outcomes. It precedes high-fidelity implementation, affects the reach of an intervention, is influenced by perceived acceptability, and is necessary but not sufficient for sustainability. When evaluating implementation efforts, always ask the fundamental question: is the intervention actually being used as intended? Fidelity is a critical implementation outcome that measures how closely an intervention is implemented as it was originally designed. Just as tools like wrenches and screwdrivers need to be used correctly to fix things, interventions need to be implemented with fidelity to achieve their intended outcomes. Fidelity has several key components. These include content, the core elements of the intervention, process, how it's delivered, dosage, the correct amount and frequency, and quality, the skill level in delivery. Let's compare high and low fidelity implementation. With high fidelity, all core elements are included, proper sequence is followed, implementers are well trained, and the intervention is delivered consistently. In contrast, low fidelity implementation might be missing core elements, have steps rearranged or skipped, inadequate training, and inconsistent application, all of which can significantly reduce effectiveness. Consider this real-world example. Just as this specialized tool must be used exactly as designed to work properly, public health interventions require specific implementation steps to be effective. Fidelity isn't just conceptual, it must be measured. Common methods include direct observation, implementation checklists, audio or video recording reviews, self-report assessments, and program documentation audits. Ultimately, fidelity matters because interventions implemented with high fidelity are more likely to achieve their intended outcomes, easier to evaluate accurately, and better positioned for sustainable implementation. REACH is a critical implementation outcome that measures who an intervention is actually helping. REACH is formally defined as the extent to which an intervention affects its intended population. It's typically measured as the proportion of eligible individuals who actually participate in or receive the intervention. Let's visualize REACH in the context of community health interventions. When examining REACH, we consider three key components. First, absolute REACH refers to the total number of participants. Second, relative REACH measures what percentage of the eligible population is participating. Third, representativeness examines how well the participants reflect the characteristics of the entire target population. Population health strategies are essential for maximizing the reach of public health interventions. To measure reach, we typically calculate the percentage of eligible individuals who participate in an intervention. This gives us a clear metric to assess how widely our program is being adopted. Several barriers can limit the reach of public health interventions. These include geographic accessibility, language and cultural barriers, economic factors, limited awareness and knowledge, and inadequate technology access. Real-world data illustrates the importance of reach. When interventions successfully reach their intended populations, they can support thousands of individuals and mobilize communities. To improve reach, implementation scientists recommend several strategies: engaging communities in program design, culturally adapting interventions, utilizing multiple delivery channels, reducing access barriers, and conducting targeted outreach to underrepresented groups. In summary, reach is essential for implementation success. It's important to measure both absolute numbers and relative percentages while ensuring representativeness across the target population. Population health strategies can maximize reach, and addressing barriers improves equity in intervention delivery. The Consolidated Framework for Implementation Research, or CFIR, provides a structured approach to understanding implementation challenges and successes. CFIR is constructed like puzzle pieces that fit together, with 5 key domains that collectively influence implementation success. Let's transition to examining the 5 key domains that make up the CFIR framework. Intervention characteristics focus on the features of the intervention itself, such as its complexity, cost, and adaptability. The outer setting refers to external influences like policies, regulations, and patient needs. The inner setting involves factors within the organization, such as culture, leadership, and readiness for implementation. Characteristics of individuals addresses the knowledge, beliefs, and capabilities of the people implementing the intervention. The implementation process encompasses planning, engaging stakeholders, executing, and evaluating the implementation. This comprehensive diagram illustrates how the CFIR framework organizes the key factors that influence implementation success. Each domain contains multiple constructs that provide a detailed lens for examining implementation challenges. Let's explore the key benefits of using the CFIR framework in implementation science. CFIR provides a structured approach to identifying and understanding the complex factors that affect implementation. It helps researchers and practitioners identify barriers and facilitators at multiple levels of influence. The framework guides the selection and tailoring of implementation strategies to address specific challenges. CFIR facilitates comparison across studies and settings, building a cumulative knowledge base in implementation science. In summary, the Consolidated Framework for Implementation Research provides a comprehensive approach to understanding the complex, interrelated factors that influence implementation success in healthcare and public health settings. The Intervention Characteristics domain is the first of 5 domains in the Consolidated Framework for Implementation Research, or CFIR. This domain focuses on the features of the intervention itself, the puzzle piece that must fit well within the implementation context. When examining an intervention, we consider several key characteristics that influence how likely it is to be successfully implemented. Let's look at complexity. A complex intervention with many interrelated components is typically more difficult to implement than a simple one. Adaptability is another critical characteristic. This flowchart shows different types of adaptive interventions that can be tailored to specific needs, enhancing implementation success. Ultimately, successful implementation depends on how well the intervention's characteristics align with the needs and resources of the setting where it's being implemented. The individual's domain of CFIR focuses on the human element of implementation. This domain examines key characteristics of individuals that influence the implementation process. Knowledge and beliefs about the intervention significantly impact how individuals adopt and implement new practices. Self-efficacy represents an individual's belief in their ability to execute the implementation successfully. An individual's stage of change refers to their readiness to engage in the implementation process. Identification with organization affects how individuals relate to organizational goals and their motivation to support changes. In healthcare settings, individual characteristics of practitioners greatly impact how innovations like infection control protocols are adopted. Knowledge transfer is a critical component in implementation. It requires a structured approach with activities before, during, and after the implementation process. To address individual factors in implementation, consider these practical strategies. First, assess knowledge and beliefs before implementation to identify potential barriers. Second, provide tailored training to build self-efficacy among implementers. Third, address individual readiness for change through targeted support. Finally, strengthen organizational identification to increase motivation and commitment. Individual characteristics represent a critical domain in the CFIR framework. Understanding and addressing these factors is essential for successful implementation. The RE-AIM framework provides a systematic way to evaluate the impact of public health interventions. RE-AIM stands for Reach, Effectiveness, Adoption, Implementation, and Maintenance. REACH focuses on who participates in the intervention. It examines both the absolute number and the representativeness of participants compared to the target population. Effectiveness measures the impact of an intervention on important outcomes. This includes both positive results and potential negative effects. Adoption looks at which settings and providers are willing to implement the intervention, considering both the proportion and representativeness. Implementation evaluates how consistently and accurately the intervention is delivered in real-world settings compared to its intended design. Maintenance examines the long-term sustainability of both individual behavior changes and organizational program delivery. The RE-AIM framework helps researchers and practitioners evaluate and address key dimensions that determine whether an intervention will have meaningful public health impact. By addressing all 5 dimensions of RE-AIM, stakeholders can ensure their interventions are not only effective, but also reach the intended population, are widely adopted, properly implemented, and sustainable over time. RE-AIM is particularly useful for planning, evaluating, and reporting on interventions intended for widespread adoption in real-world settings. The Theoretical Domains Framework, or TDF, provides a comprehensive approach for understanding behavior change in implementation science. TDF synthesizes multiple psychological theories into distinct domains that influence behavior change. At the core of TDF is the concept of theoretical domains, each representing different influences on behavior. The key domains include knowledge, skills, beliefs, and social influences, each representing different factors that can impact behavior change. These domains align with constituent elements of competence. For example, intercultural competence requires knowledge, skills, and attitudes working together. The TDF consists of 14 domains of theoretical constructs identified as relevant to understanding behavior change. Beyond the core domains we've highlighted, TDF includes environmental context and resources, emotion, behavioral regulation, memory and decision processes, and reinforcement, among others. TDF helps implementation scientists identify the factors influencing target behaviors, including capability, opportunity, and motivation. In practice, TDF is used to identify barriers to implementation, design targeted interventions, and tailor behavior change strategies to address specific domains. The EPIS framework outlines 4 critical stages in the implementation process. EPIS stands for Exploration, Preparation, Implementation, and Sustainment. These 4 stages represent a comprehensive approach to implementing evidence-based interventions. The exploration stage is where identifying the need for change, assessing organizational readiness, exploring available EBIs, examining fit with current practices. The preparation stage is where developing implementation plans, securing necessary resources, building stakeholder buy-in, adapting interventions to context. The implementation stage is where executing the implementation plan, training staff, and building skills, providing ongoing coaching, monitoring initial implementation. The sustainment stage is where institutionalizing new practices, ensuring ongoing support, maintaining fidelity over time, adapting to changing conditions. The EPS framework is cyclical in nature, as lessons learned in sustainment often lead to new exploration phases for continuous improvement. By following the EPIS framework, implementation scientists can systematically approach the complex process of translating evidence into practice. Let's examine a real-world application of implementation science, the uptake of HIV pre-exposure prophylaxis, or PrEP. PrEP is a daily medication that can prevent HIV infection in high-risk individuals. Public health efforts have focused on increasing its adoption. Implementation science frameworks have been instrumental in guiding the rollout of PrEP programs. The Consolidated Framework for Implementation Research, or CFIR, guided the adaptation of outreach materials for different communities. CFIR helped identify barriers to PrEP uptake in different healthcare settings and analyzed how the intervention's characteristics affected adoption. The RE-AIM framework was used to measure PrEP uptake among target populations and track how many eligible individuals started using PrEP. It also helped track the effectiveness of PrEP in reducing HIV incidence and evaluated how many patients remained in PrEP programs over time. The EPIS framework tracked the full implementation process across clinics. During the exploration phase, community readiness for PrEP was assessed. In the preparation phase, healthcare providers were trained to prescribe PrEP. The implementation phase monitored how PrEP was actually delivered, while the sustainment phase tracked the scale-up of PrEP programs across multiple clinics. By applying these implementation science frameworks to PrEP rollout, public health teams achieved several important outcomes. These included increased PrEP uptake among high-risk populations, improved retention in PrEP programs, better targeting of outreach efforts, and more efficient scale-up across healthcare systems. This case study demonstrates how different implementation science frameworks can work together to address a complex public health challenge. CFIR guided the adaptation of outreach materials, RE-AIM measured uptake and retention, and EPIS tracked scale-up across clinics. Stakeholder engagement is a critical component of successful implementation science efforts. It brings together diverse perspectives to guide research and address gaps between evidence and practice. Effective stakeholder engagement bridges the research-practice gap, ensures interventions are relevant to real-world contexts, and increases the likelihood of adoption and sustainability. Who are the key stakeholders in implementation science? They include policymakers, who set regulations and allocate resources, practitioners who implement interventions directly, community members who receive and influence these interventions, and researchers who develop and evaluate them. Successful implementation requires meaningful collaboration among all these stakeholders, creating shared understanding and aligning priorities. Effective stakeholder engagement follows a structured process. It begins with developing an engagement strategy, then mapping who the relevant stakeholders are. Next comes thorough preparation, followed by the actual engagement activities. Finally, translating discussions into concrete action plans ensures stakeholder input leads to meaningful changes. Successful stakeholder engagement requires clear objectives and expectations, inclusive and diverse representation, and ongoing, not one-time interactions. Assessment of stakeholder engagement occurs across multiple phases. This begins with inputs, what resources and perspectives stakeholders bring. The process then moves through implementation activities, immediate outputs, intermediate outcomes, and finally long-term outcomes. Each phase requires different metrics and feedback mechanisms. A key function of stakeholder engagement is identifying gaps between current practices and desired outcomes. Stakeholders provide crucial insights about where implementation barriers exist and how to bridge these gaps effectively. Meaningful stakeholder engagement yields numerous benefits. It improves the relevance of implemented interventions by ensuring they address actual needs. It increases uptake through greater buy-in and adoption, and it enhances sustainability, contributing to the long-term viability of interventions. Effective stakeholder engagement is increasingly data-informed. Sharing data with stakeholders builds common understanding of challenges and opportunities. It helps prioritize implementation efforts based on evidence and supports collaborative monitoring and evaluation of implementation initiatives. To summarize, stakeholder engagement is essential, not optional, for successful implementation science initiatives. It should be systematic and well-planned. Multiple perspectives strengthen implementation efforts, and early and consistent engagement yields the best results. The future of implementation science is evolving to address emerging challenges in public health. Several important trends are shaping the field's direction. First, there's an increased focus on health equity, aiming to improve the speed and reach of evidence-based interventions to marginalized communities. Second, implementation science is being integrated with technology design from the outset, ensuring practical application of new technologies. Third, AI and machine learning are enhancing the precision and efficiency of implementation strategies. Data science trends are significantly influencing the future of implementation science. Technology integration typically follows a maturity model, progressing from directed use to self-directed innovation. Implementation science can leverage this model to better understand how technologies are adopted in practice. The implementation process itself is evolving. Future implementation science will incorporate more sophisticated hypothesis verification and business case development approaches, especially when implementing AI and machine learning solutions. Other important future directions include learning health systems for continuous improvement, increased focus on scalability and sustainability, integration of digital health technologies, climate-related health adaptations, and addressing global health implementation challenges. This brings us to the conclusion of our journey through implementation science and its role in achieving lasting public health impact. Implementation science equips us with the tools, frameworks, and strategies to turn proven interventions into everyday practice. As we've seen throughout this series, there are multiple approaches to implementation. Both provider-centric and user-centric models can be effective when applied appropriately to the right context. To achieve lasting impact, we should use frameworks like CFIR, REAIM, TDF, and EPIS to guide implementation efforts. Successful implementation requires a sustainable model that integrates research with practice, as illustrated in this model for nurse-led research implementation. By systematically applying these principles, we can effectively bridge the evidence-to-practice gap and improve health outcomes for communities everywhere. The ultimate goal of implementation science is not just to develop knowledge, but to ensure that evidence-based interventions reach those who need them most, creating meaningful and lasting public health impact.